hypertrophy is a word to describe tissue growth. Okay, tissue growth. Now, with hypertrophy, we're basically this tissue is getting larger because of an increase in the size of cells. Okay, not an increase in the number of cells, an increase in the size of cells. Now this type of growth or adaptation occurs in cells or tissues that are incapable of undergoing mitosis. All right, for example, the heart and skeletal muscle. All right, these are tissues that gave up their ability to, biologically, genetically gave up their ability to undergo mitosis. During embryonic development. All right, but that doesn't mean these cells can't grow. They just can't grow in number. But what they can do is grow in size. All right, and obviously this can, this can happen under normal conditions. You don't need me to sit here and give you a large, elaborate lecture on how weightlifting makes your muscles bigger. Obviously there's a lot of complex mechanisms behind that, but you know that. All right, you know that when you lift weights, your muscles, your skeletal muscles get larger. If you exercise, like running or cycling or even weightlifting, if you're exercising, your heart is going to get larger as well. But under normal conditions, hypertrophy is going to A, be proportional to the stress, and B, there's a certain limit as to how big these tissues can naturally grow. All right, because you have to remember that, that as we apply stress to these tissues, that is why they are growing, to basically meet the demands of the stress that they are experiencing. All right, and if we're talking skeletal muscle, this will also cause, bone mass to go up as well. All right. Now, when we, what was I going to say? Oh, the reason why, basically, like I said, this is going to be proportional to the stress that we apply to these tissues, like if it's weightlifting or running or both, depending on what you're doing. Or it doesn't always have to be, the type of going to the gym and exercising kind of stuff. If you've seen a person who's a career logger, who goes out in the woods, cuts down trees, stacks wood, someone who has earns a living as a mason and spends hours a day laying block. These are people that are going to be bigger built because of their job. So it's not always, it's not always, you don't have to go to the gym to be in shape. You can just be active, spend time outside, and so on, and push yourself. All right. Or if you have a profession, you get the point. All right, but these cells are going to hypertrophy. They're not going to get too big naturally because remember, the reason why cells are so small is because we want to rapidly get oxygen in and carbon dioxide out. All right, and obviously as these muscle cells and tissues get larger, we're also going to increase the amount of vessels around them. All right, but again, we're only gonna be able to do this to a certain point. That's why you kind of reach a peak or a plateau in your ability to basically become bigger and stronger. And then this is what pushes professional athletes to try to go beyond these natural limits and use performance enhancing drugs. All right, and make more money because pro athletes get paid well no matter what. All right, so. Same thing with the heart. Structurally, the heart contains sarcomeres, the same contractile proteins the skeletal muscles do. So they're gonna, the heart is gonna grow as well. But like I said, it's only gonna grow proportionally. Now, there's another factor we have to look at here with the heart is that remember the main job of the heart is to pump blood. All right, the job of the heart is to pump blood. So we can't allow this heart to get too big and too out of control because then it will eventually become an ineffective pump, which I'll elaborate more on when we get to cardiovascular complications. All right, but this is an example here of a oversized left ventricle. All right, this is an example of an oversized left ventricle. So basically, one of the causes of this would be, chronic hypertension or chronic high blood pressure. All right. All right. So someone has hypertension, whether they take care of it or not, it's gonna cause the heart, the ventricles to increase in size. Obviously, if you don't take care of yourself very well and keep that blood pressure down, this is it's going to get big, and it could get to the point to where it gets too big. All right, where this ventricle gets too big, and it makes it, like I said, it will eventually turn it into an ineffective pump because it's going to be harder to get blood out of a larger ventricle. Excuse me. All right. Or there could be narrowing of a valve, right? Whether it's the pulmonary or the aortic valve. Typically, it's the aortic valve that you see, these, more of the valvular problems with in the heart, just due to the, the stress of, of that ventricle, blood flowing out of that ventricle. But again, if you see narrowing of that valve, I mean, this should be just common sense. If we're trying to pump the same volume of blood through a more narrow opening, well, how's the heart going to compensate for that? It's going to pump harder. It's going to increase. It's going to work harder, and then as a result, this muscle tissue is going to dramatically increase in size and eventually turn the heart into an ineffective pump. Okay, so that's hypertrophy, when cells and tissues get larger due to the cells getting larger, not due to an increase in number, just due to an increase in overall size.